Hi there, my name is Dalton Turner, and I'm a pharmacist as well as an intern at the Columbiana County Health District in Columbiana County, Ohio. Today I'll be discussing tick-borne diseases with my colleague Dylan. This is especially important right now because of the increased incidence of tick-related illnesses in Columbiana County as well as the state of Ohio in general.
As Dalton mentioned before, my name is Dylan Ware. I'm a PGY1 pharmacy resident. So Dalton, the first question I have is, what is Powassan virus disease?
So, Powassan virus disease is a rare but potentially serious condition that is caused by exposure to ticks that are infected with Powassan virus. It gets its name from the town of Powassan in Ontario, Canada, where it was discovered by a boy who had developed encephalitis, or a brain infection, and died from Powassan virus disease in 1958.
Now that we've discussed what Powassan virus disease is, the next thing I want to know is, how is it transmitted?
Powassan virus disease is spread to people by ticks. In Ohio, the primary tick of concern is the black-legged or deer tick. It may also be transmitted by other ticks, such as the groundhog tick or the squirrel tick.
So where have Powassan virus disease cases been confirmed, and how many have been diagnosed in Ohio?
Within the United States, most cases have occurred in the northeastern states and the Great Lakes regions of the United States during the late spring months to the mid-fall season. During these months, the ticks responsible for transmission are most active. Only one case has been confirmed in Ohio at this time, and this case was diagnosed in October of 2021. However, the neighboring state of Pennsylvania has had 10 cases of Powassan virus disease from 2011 to 2020.
So who can be affected by Powassan virus disease?
Anyone that may be bitten by an infected tick is at risk of developing Powassan virus disease. Those who are most exposed to brushy, wooded areas have the highest risk of exposure.
So now that we know who's affected by the virus, how do I know if I have Powassan virus disease?
You would know by your symptoms. So the initial symptoms of Powassan virus disease are fevers, headaches, vomiting, and weakness. It can also cause brain infections, that's called encephalitis, or meningitis, which is the infection and inflammation of the spinal cord and the region surrounding the brain. In these cases, it may cause confusion, disorientation, difficulty speaking, and seizures.
So you've talked about what symptoms the virus can cause. How long does it take for those symptoms to develop?
It varies. The time from the tick bite to feeling sick may vary anywhere up to 1 month.
So how would a healthcare practitioner diagnose Powassan virus disease?
Healthcare providers use several identifiers to diagnose Powassan virus disease. This ranges from signs and symptoms of the disease and possible exposure to ticks. However, laboratory testing of blood or spinal fluid may be necessary to confirm the diagnosis.
Once an individual is diagnosed, what treatment options exist for Powassan virus disease?
There are no medications developed to treat Powassan virus disease. Patients may need to go to the hospital to treat the problems caused by the disease, however. These treatments would reduce the swelling in their brain, hydrate them, and provide support to help them breathe.
So, no medications exist, but is there a vaccine to prevent Powassan virus disease?
No vaccines exist to prevent Powassan virus disease. At this time, the best practice for preventing Powassan virus disease is to prevent tick bites entirely.
So what should I do if I think I have Powassan virus disease?
If you think you have Powassan virus disease, let a healthcare provider know if you feel like you're developing symptoms. Because deer ticks are small, it is possible to have been bitten and develop Powassan virus disease without realizing it.
I'd like to transition to talking about another tick-borne illness. I have a few questions for you about Lyme disease. To begin, I'd like to ask you just to give me an overview of what is Lyme disease.
Lyme disease is a disease that's caused by a bacteria. It gets its name from Lyme, Connecticut, after a woman identified a series of pediatric arthritis cases and brought these to the attention of Yale researchers. This particular type of arthritis is actually now known as Lyme arthritis.
How is Lyme disease transmitted?
Lyme disease is transmitted by infected ticks. The most common tick that spreads Lyme disease is the black-legged or deer tick in this region. However, the western black-legged tick is more common on the west coast of the United States. This is the same tick of concern with Powassan virus.
So where have Lyme disease cases been confirmed, and how many have been diagnosed in Ohio?
Each year, about 30,000 cases of Lyme disease are reported by state health departments. However, there may be more that aren't reported. In 2021, 124 cases of Lyme disease were confirmed in Ohio. In Columbiana County specifically, 10 cases of Lyme disease were confirmed. The highest number of cases were reported in the northeastern states.
So who is affected by Lyme disease?
Like Powassan virus disease, anyone that may be bitten by an infected tick is at risk of developing Lyme disease. Those who find themselves in brushy, wooded areas have the highest risk of exposure.
So how would I know if I contracted Lyme disease?
Initial symptoms of Lyme disease include fevers, chills, headaches, fatigue, and aches in the muscles and joints. A common symptom of Lyme disease is the bullseye-like rash that occurs in about 7 to 8 of every 10 cases. This rash may appear from 3 to 30 days after a bite, though the average is 7 days. The rash may feel warm but not itchy or painful. Late symptoms include neck stiffness, loss of muscle tone, droop on one or both sides of the face, arthritis such as Lyme arthritis, Lyme carditis such as heart palpitations or irregular heartbeat, and inflammation of the brain and spinal cord called neurologic Lyme disease.
How long does it take for symptoms of Lyme disease to develop?
Timing of symptoms is important in Lyme disease. Initial symptoms will occur within the first month after being bit, and about 7 days is the most common. Late stage symptoms will occur after the 1 month mark or after several months after being bit.
And how is Lyme disease diagnosed?
Healthcare providers diagnose based off of symptoms and signs of Lyme disease, as well as by exposure to infected ticks. Laboratory tests are also used to confirm diagnosis.
What treatments exist for Lyme disease?
Although Lyme disease and Powassan virus are spread by the same type of tick, Powassan virus disease is caused by a virus for which antiviral medications are not available. Lyme disease is spread by a bacteria for which antibiotics are available. It may take 2 to 4 weeks of treatment to cure the infection. It is important to treat Lyme disease early to prevent more severe symptoms from developing later on.
So speaking of early treatment, is there a way to prevent Lyme disease, such as a vaccine?
There is no longer a vaccine to prevent Lyme disease in humans. A vaccine previously available within the United States, LymeRix, was taken off of the market in 2002. Because the immunity that it offered decreases over time, those vaccinated with LymeRix likely do not have immunity anymore.
What should I do if I think I have Lyme disease?
If you suspect that you have Lyme disease, then let a healthcare provider know right away. Early detection will allow for treatment before more serious symptoms develop. Remember that deer ticks are very small, and many who are exposed are unaware that they may have been bitten.
Finally, what is chronic Lyme disease?
Symptoms of Lyme disease that last for more than 6 months after finishing treatment is called post-treatment Lyme disease syndrome, or PTLDS, although sometimes chronic Lyme disease is a term that is used. It is not common for this to happen, and symptoms generally will improve on their own over time.
I'd like to transition now from talking about the diseases that ticks cause to talking about general tick prevention. To begin, how do you prevent tick bites?
The best way to prevent tick bites is to use EPA-registered insect repellents. These are safe and effective even for those who are pregnant or breastfeeding. Use clothing to provide a barrier to the skin, wear long pants, and tuck them into your socks. Apply permethrin to clothing, but do not apply it directly to the skin. Wearing light colors makes it easier to see the ticks. Otherwise, avoid tall grass and brush and exposure to places where ticks live.
Nice. And what should be your plan of action if you find a tick on you?
Remove the tick by using fine-tipped tweezers to grasp the tick as closely to the surface of the skin as possible. Pull it directly away from the skin with even pressure. If any of the mouth parts remain in the skin, remove them with the tweezers. Dispose of the tick by putting it in alcohol, placing it in a sealed bag or container, or flushing it in a toilet. Never crush a tick with your fingers. Wash your hands and the bite area with soap and water afterwards. Do not use folk remedies such as petroleum jelly, a hot match, or nail polish to remove the tick.
My final question for you today is, what is the Columbiana County Health District doing to help reduce the spread of Powassan virus disease and Lyme disease? What services are offered for those concerned about ticks?
The Columbiana County Health District is now involved in tick collection and identification. If Powassan virus disease is suspected, ticks may be sent to the Center for Disease Control and Prevention for confirmation. However, this function takes additional time for the results to be processed. The Columbiana County Health District is also actively engaged in monitoring Lyme disease cases and serves as a resource of information for those concerned about tick-related diseases. Thank you very much for listening to our discussion today. If you would like to contact the Columbiana County Health District, they may be reached at 330-424-0272 or at www.columbianahealth.org.